picture. This is an ultrasound study of a 55-year-old female with a history of fever with rigors for the last 2 weeks. And then straight away in front of you, I am providing the reason. And what we see is that this kidney, the left kidney that is in view, that measures approximately 11.3 up to 11 is normal in length, and 4.5 centimeter in anterior-posterior diameter, up to 5 is normal, so it's normal in dimensions. Secondly, see that the parenchymal echogenicity is globally, is diffusely decreased as compared to the normal kidney, if you remember what the normal kidney parenchyma looks like. However, the corticomedullary differentiation is intact. As you can see, this is the medulla, here is the medulla, this is the medulla. So corticomedullary differentiation is intact, as well as the parenchymal thickness is preserved at all levels. This is the mid-anterior region parenchyma, this is the upper pole parenchymal thickness, and this is the lower pole parenchymal thickness. And the thickness at the anterior pole, that of the parenchyma, is 15.5 millimeters. At the upper pole, this one is the 18.1 mm, and at the lower pole it's 15.7. So the echogenicity is diffusely raised as it decreased. This is the decreased echogenicity, that of the renal parenchyma of the left. Okay, then, and the parenchymal thickness is normal. The pyramids are seen. Corticomedullary differentiation is intact. Now, what's seen is that there is no central sinus hypocomplex fat seen. Rather, what we see is dense, coarse, echogenic particles. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So there are multiple, and from the lower pole to the upper pole, in all the regions of the collecting system, we see echogenic areas, and they are more echogenic than calculi. Few of them are giving dirty shadow. Here you see, this is the shadow from this one, and this is because of the overlapping of these echogenic particles. Few are very shiny, more shiny than a calculus or calcified area. See this linear area. This is suggestive of a very shiny linear structure. And now you will see few of them will be giving this posterior shadow, dirty shadow. This is a dirty shadow. Not a sharp shadow is not seen so far. And now you see this one. If I show you this intensely echogenic, or otherwise in a simple one letter, shiny echogenic linear area measuring approximately 11.5 mm, is giving a reverberation artifact. You see this one, this is the reverberation artifact seen from it, and this is you can say a chromatal artifact as well. So, however, we can say that the possibility of the emphysematous pyelonephritis cannot be ruled out until unless we have sufficient, Now you see this one, this echogenic, this shiny particle. These are more shiny than the calcified area or calculi that you see in the or we see in cases of nephrolithiasis, and this shiny area is giving a typical you see this shadow, which is a reverberation artifact, and these are usually seen from the air. So this is most consistent with this is a combination of calculi as well as air within the collecting system. This one is air giving us reverberation artifact. So just by ultrasound finding, one can say that this is a case of emphysematous granulomatosis, glomerulonephritis. I am going to magnify for you so that a better understanding can be developed. You see, they are in all the calazial system from the upper to the lower pole. None of the areas spared all this multiple echogenic area, dirty shadow, few giving comatose artifact, few giving sharp shadow, so all types of. So this is consistent with. This finding is very much consistent with. You see, now I'm going to show you typical comatose artifact. This is a shiny particle at the lower pole, at the upper pole. Sorry, this one is the and this area, if you see, is giving us a comatose artifact, and comatose artifact is seen from here most commonly, and you can also see this that there is diffuse decreased parenchymal echogenicity with preserved pyramids or corticomedullary differentiation. So this is here. I am showing you one. There are other as well, and which raises the possibility of the possibility of emphysematous pyelonephritis, emphysematous pyelonephritis, that of the left kidney. Few other echogenic particles are seen, but here focus is the upper pole of the left kidney. Now, what is the status of the right kidney? Let's have a review of that as well. This is the right kidney, and you can see that even in the right kidney, what we see is there is muffling of the central sinus echo complex. The fat is not seen. I've seen it's muffled rather. Somewhat seen. This is the central sinus echo complex fat line. There is significant dilation of the pyramids, and there is the parenchymal echogenicity is more as compared to the liver adjacent to it. This is the parenchyma, renal parenchyma. I have just taken a part of it, compare with the liver. This is the liver parenchyma. See that this is the renal parenchyma, and this is the liver parenchyma. Okay, so the echogenicity of the parenchyma is more as compared to the adjacent liver, which is opposite to the expected normal, because in normal conditions, the echogenicity of the renal parenchyma is either equal to or less than that of the adjacent liver parenchyma, provided the liver is normal. Here the liver is normal. यारों ने मना कर कुछ और नहीं करे, चुप करके काम कर यार. Now let's magnify and see. You can yourself see the degree of not dilation, but the significant prominence of the renal pyramids at all regions. These are the pyramids. See, this is one I am showing you with the arcuate vessel at its anterior end. This is the arcuate vessel. So both kidneys are involved. This kidney is showing findings of pyelonephritis, and the other one is consistent with now this is the other one is consistent with Emphysematous pyelonephritis. This is the transfer section of the right kidney, and the hilar region is okay. The vessels are patent. You can see this is the hilar region on that of the kidney. You can see the right renal vein entering the eye. You see this is the right renal artery entering the aorta. So it's okay. So the right kidney, situation, and the left kidney. Thank you very much. This is our case of the day. Now in this particular view you will see another linear echogenic area. This one measuring approximately 7.2 is at the lower pole of the left kidney, and you see that this triangular shaped area is a ring down artifact. In particular, this was to show you that how the ring down artifact is seen, and here these echogenic particle areas are giving dirty shadow. Dirty shadow along with ring down artifacts, are sonographically a bit consistent with very early stage of. This is a very early stage of Emphysematous granulomatous pyelonephritis. I want to show you another thing here. See, this is the capsule of the kidney, left kidney. You can see fluid between the parenchyma. This is the parenchyma, and this is the capsule. And you see there is small amount of fluid seen at the upper pole, anterior upper pole of the left kidney. And similarly, this echogenic area is giving dirty shadow. And why I'm saying that sonographically this is stage 1, because the parenchyma is not destroyed, and as this disease progresses, the parenchyma will be destroyed, and air bubbles will be seen, or air fluid level can be seen. Similarly, the stages go on. Now, in this particular case, which is under study, the left kidney's parenchyma, though showing diffuse decreased echogenicity, is preserved. We also know that CT scan is the best modality for the classification, identification, as well as the classification of this particular pathology called emphysematous pyelonephritis. Now you see these dirty shadow, calculi as we know, or calcified areas will give sharp posterior shadow, not dirty shadows like this, not dirty shadow like this. So I have my reservations regarding this. As CT scan will be required. I am only provided with the urine report, which shows proteinuria, hematuria, pyuria, and as well as glucose 2+. So this is a dirty shadow. See, typical dirty shadow that we see in bowels is seen in this region. Muffled central sinus echo complex, all in the collecting system. Very much typical of. Rarely we come across such a case. This is a magnified view to show you the shadows, particular. Now you see this is a typical rain down artifact. This one. So ring down artifacts, comet tail artifacts, dirty shadow. Now had it been a calcified area, this one, this linear, bright, shiny area, then it should have been given. It should be giving a sharp shadow, posteriorly black. It should have been all black. But you see, this is the dirty shadow that we are seeing from this densely echogenic area. So this is our case of the day. Thank you very much.